Following are the types of aortic regurgitation based on the mechanism. Type 1 normal wall cusps with incomplete coaptation due to aortic root dilatation and a central regurgitation jet. Any of the components of the aortic root including annulus, sinuses of Valsalva and sinotubular junction exceeds normal limits. Type 2 eccentric regurgitation jet due to cusp prolapse or fenestration. When the free edge of one or more aortic cusps passes beyond the plane of the aortic annulus, it was considered as prolapse. Type 3 retraction with poor quality of cusp tissue producing a large central or eccentric jet. This classification was used to predict surgical reparability and outcome based on transesophageal echocardiography. In that study, agreement between TEE findings and surgical inspection findings was 93%. Final surgical approach could be predicted by TEE in 86% of those undergoing aortic valve repair and in 93% of those undergoing aortic valve replacement. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.